First of all, what we have, pericarditis. Pericarditis. This is a known anatomy of pericardium. Study a normal physiology of pericardium and lines of management of pericarditis, including either purulent or tuberculosis or maybe constrictive pericarditis, and be familiar with the surgical pericardial procedure. Now, the anatomy, as you remember of the lung, it has contain two pleurae. This is parietal and visceral pleurae. Also on the pericardium, we have two pericardium. We have visceral pericardium, that it will be inside of the heart, and outside of the heart, this is what we call the parietal pericardium. Parietal pericardium. This is as we shown. This is as we shown. It will be have a fibrous. It is an outer, an inner one. It will be a visceral one. Visceral one. Now, what is the sorry? What is the normal physiology? Why we have a pericardium? And why our God created this pericardium? As in the skull that will protect the brain, also the pericardium, it will be protect the heart. First of all, it will be fixed the heart inside. When any moving, any change of the position of the patient, still the heart inside is not moving, like the bowel or other part of the body. It is a mobile one. The heart is fixed in its place. Second, it will be reduce the friction between the heart and surrounding organ. لما ترتك السراوندينج area الموجود عندك اللانج باللانج, it will be protected and it will be make a reduce of this friction material between the lung and the heart, and also act as a barrier to the spread of infection from malignancy or from the local structure, particularly from the lungs. What is acute pericarditis? Acute pericarditis, acute means inflammatory process. It is an inflammatory process of pericardial sac, either exudative or maybe effusion. This is maybe not present. Etiology, maybe idiopathic. You don't know the cause of that one. Maybe a viral, bacterial, or maybe fungal, or maybe tuberculosis. Pericardial invasion by adjacent tumor, commonly from the breast or lung or lymphoma. Or maybe during a complication of aortic dissection, when the blood leaks from the aorta to the pericardial space. Or maybe after transmural myocardial infarction, or maybe after a plant or penetrating trauma to the heart, maybe occur after cardiac surgery, or maybe after mediastinal irradiation, post-malignancy, or maybe a patient have uremia. Uremic patient, he have pericardial effusion maybe. Connective tissue disease, rheumatoid arthritis, or systemic lupus erythematosus, or maybe a scleroderma. Purulent pericarditis means a collection of the pus inside the pericardial space, maybe due to the pneumonia, or maybe due to the penetrating trauma, or maybe homogeneous separated from the cardiac, lung, or esophageal surgery. In rare cases, we have result from the rupture of subphrenic or hepatic abscess into pericardial space. This is a rare thing, but can occur if we have a subphrenic abscess or hepatic abscess may be perforated to pericardium. The representative of that one, of purulent pericarditis, the patient who have a chest pain, centrally chest pain, and it will be sharp in character of that one and associated with the fever. And maybe a more severe when you have accumulation of pus, that it will be lead to decompensation of the heart function. That's what we call a cardiac tamponade. How you can establish your diagnosis? By pericardiocentesis. You took a sample from the pericardial space and send it for cultural sensitivity, also for acid-fast bacilli, and also for cytology to exclude any malignancy. And beside that, you should be repeated in pericardiocentesis if you have a cardiac tamponade to relieve a tamponade. And this is sometimes we need to do an open pericardiectomy and maybe a pleasant of the drain inside and irrigation of that one. The worst thing that we face it in our surgery, يعني this is لما يجيني يعني bacterial viral ما يهمني بقد ما يجيني المريض انه tuberculous pericarditis, because this is a chronic disease. It will be, as a body defense, it will be to the fibrosis and constrictive that one. So the tuberculosis may be start in other side of the body and separated to the pericardium by bloodstream, or maybe direct extension from the pleura or the blank, or maybe from mediastinal lymph node or lymphatic. Any route may become and affected the pericardium due to the tuberculosis, TB pericarditis. Symptoms of that, not like in the acute purulent one, it will be يعني sudden one, have a severe, sharp pain. Here, insidious, it will be gradually of the onset, and both maybe have, when you have a pericardiocentesis, maybe when we aspirate it, may become a surplus of fluid or maybe a blood. It should be sent for the acid-fast bacilli to confirm your diagnosis. This is due to the tuberculosis. Now, how you treated this one? Should we start with the anti-TB, and this is with the anti-TB, you should be given steroid because it is an extrapulmonary one. Steroid, it will be make a less complicated of fibrosis with the TB pericarditis. An early operative resection of that, the advice when we have symptoms from acute phase have result. يعني أنا من اليوم بدأت عندي الأعراض مالتي اعطيتها at least for 6 weeks of anti-TB. I should be follow it by echo and even by cardiac catheterization to see if there's any early restriction before a start of the severe fibrosis and adhesion to the myocardium. I do a surgery for them, peeling of pericardium. This is what we have the same things in the lung, what we call decortication. Here we should be do a pericardiectomy. In hemopericardium, what is the causes of hemipericardium? Mean a collection of blood inside the pericardial space. Maybe due to the trauma, either penetrating or planted trauma. Maybe due to the recent mediastinal operation, يوم داشتغل على thymus or داشتغل على cardiac surgery, maybe have a complication of that, it will be collection. This is more occur when you have يعني many surgical procedure doing in one day of open heart surgery at night. Maybe you have, يعني when we do a 10 operation of cardiac surgery, open heart surgery, maybe at least 3 to 4 of them, it will be opening at evening because of the hemipericardium. This is in outside, not only in Iraq. This is occur because of the rapid turnover of the patient in the theater. Maybe have incomplete hemostasis done during the surgery. So at night, maybe have this patient have hemipericardium, it should be reopening of that one to stop the bleeding. Maybe due to the coagulopathy, or maybe due to cardiac perforation caused by the instrument during the PCI, يعني percutaneous coronary intervention, or maybe due to cardiac rupture trauma, or maybe due to the aortic rupture. The acute hemipericardium resulting in cardiac tamponade. This is required an emergent treatment. Like in the tension pneumothorax, this is the top emergent things. You should be decompress the pericardium, because otherwise it will be lead to the low cardiac output, and it should be that immediately this patient will be collapse and dead. When we have a collection of hemicardium and acute ischemic tamponade, suppose we have a 1000 cc of that blood. When you aspirated only 5 to 10 cc, it will be lead to the survival of this patient. يعني إذا تسحب 5 إلى 10 cc من الألف, and it is a life-saving procedure. يعني قللت immediately. لكن باللونج chronic pericardial tamponade, it is not so important like in the acute. بالacute لأن عندنا عادة بالacute cardiac tamponade, and this is a rapid accumulation of the fluid inside pericardium. You should be immediately evacuated. At least if you evacuate a small amount, it will be survive this patient. بينما بالchronic, not necessarily it is a rapid procedure, because it is a slow, insidious, and gradually accumulated of that fluid. So it will be compensated by the gradual filling of pericardial sac, not in acute stage, rapid accumulation of the pericardial sac by the fluid. And should we treat the underlying disease that lead to the hemipericardium? And hemipericardium cause a percutaneous cardiac puncture. Maybe during the يوم diarrhea, so pericardiocentesis. During pericardiocentesis malty, maybe I rupture the left ventricle or right ventricle, and lead also to the collection of hemipericardium. The worst thing that we face in surgery, it is a constrictive pericarditis. Constrictive pericarditis results from the TB in most common, or post-radiation. It lead to this constrictive pericarditis. It will be reduced the volume of pericardial sac itself, and sufficient reduced relatively of, but there is no space for the volume in the ventricles. It will be restricted, so the cardiac filling, it will be impaired, and it will be gradually absent or abnormal volume. The wall of pericardial sac, it is almost thickened. بالconstrictive pericarditis, normal pericardial thickness is only 1 to 2 millimeter. Here it is start thickening more than 3 millimeter to 20 millimeter of thickness. Chronic elevation of venous pressure in constrictive pericarditis mean an increase in JVP and low volume and muffled heart sound. And there is, because of this constrictive, we have the inflow to the heart, it will be restricted. All the venous return, it will be restricted. So you have a hepatic congestion, and if it is a long-standing, what we call it, it leads to the cardiac cirrhosis, and also lead to the protein losing enteropathy and nephrotic syndrome. Etiology, it is idiopathic. Pericardial closure at the time of routine cardiac may be induced some degree of immediate pericardial constrictive. يعني عادة عندما نشتغل بالopen heart surgery إذا أسوي كبج ما أسد ما أسد البريكارديوم، لكن لما أشتغل على الفالفولار ممكن أن أشتغل على HD. I will be close the pericardium. I close the pericardium. Always when you have a tear in the pericardium, a small tear pericardium, you should be patched, or you should be complete removal of pericardium. Otherwise, it will be herniated of the heart and lead to the sudden death if there is a herniation of the heart through the window of pericardium. يعني أنا إذا عندي اليوم فتحة صغيرة بالبريكارديوم لو أسدها لو أفتح البريكارديوم حتى أخلي الهارت it will be free to prevent any herniation of the heart inside of this hole, small hole of the pericardium. Mediastinal radiation leads to the constrictive, as I mentioned. Tuberculosis is more common, lead to the constrictive pericarditis, and less frequently that lead to restrictive pericarditis in acute pericarditis secondary to the viral bacteria. قليلا ما نشوف بالبوست فايرال لا قليلا بالبكتيريا احتمال بالفنجل مو يعني limited number maybe you have a restrictive pericarditis لكن بالchronic renal failure repeated we have a pericardial effusion uremic maybe you have constrictive in rare cases also connective tissue disease maybe lead to this one or drug therapy or trauma maybe lead to this constrictive pericarditis. Diagnosis of that one, by the history, it will be have a fatigue or dyspnea because low cardiac output, retrosternal chest pain may be present, and abdominal discomfort because of the congested liver. And because of symptoms of pulmonary venous congestion, have a pulmonary vein problem, orthopnea, nocturnal dyspnea, and this is a rare one. And physical examination, it will be inspiratory jugular venous distension. This is what we call the cosmal sign. Arterial pressure may be low or normal, but there is a narrow pulse pressure. An apex impulse may be a soft and diffuse. A right side heart catheterization. It will be appear as square root. This is what we see it in the right and left ventricular pressure tracing, or by echo, or by CT scan, computer tomography, or MRI, magnetic resonance. It will be show the constrictive one, the pericardial thickening to see, and right ventricular diastolic collapse, and minimum maybe have a pericardial fluid. Chest X-ray, the cardiac silhouette may be normal or slightly enlarged, and there is a dense pericardial calcification if it is for long time period of the tuberculosis. Treatment, pericardectomy, remove of pericardium. Indication for surgery, first of all, we can do a pericardectomy indicated if there is an effusive pericarditis with or without tamponade and respond to the medical therapy. A chronic constrictive pericarditis, tuberculosis pericarditis, or neoplastic or neoplastic or uremic pericarditis. What is the procedure we do? Pericardiocentesis, this is where you can do it by subxiphoid process where I inserted a needle, subxiphoid, in 45-degree. It will be directed to the mid-clavicular line of the left side. I start to aspirate it under the guide of ECG monitor or under echo monitoring, to aspirate it of this fluid in pericardial sac. Or maybe have a subxiphoid pericardial window. I will be open subxiphoid and I cut the xiphoid process and I make a hole inside of that pericardium. Or maybe I do a pericardioscopy, or maybe transpleural pericardial window. transpleural pericardial يعني افتح left anterior left the thoracotomy and go directly to the pericardium and make a window there, or maybe transdiaphragmatic pericardial window, or pericardectomy. This is a need a sternotomy, median sternotomy, and maybe in severe cases it need a cardiopulmonary bypass to prevent any damage to the coronary artery. This is the procedure subxiphoid, how we can do it, technique of subxiphoid pericardial window. And this is a transthoracic either by thoracoscope, make a pericardial window. And this is how we do a pericardiectomy. First of all, you should be remove all constrictive pericardium anteriorly. Posteriorly, it's not necessary to remove it, but the anterior pericardium, you should be remove it to release all the arterial flow and venous inflow to return back to the normal one. This is always done by the median sternotomy, and I mentioned before maybe it needs an extracorporeal circulation by doing a femoral bypass extracorporeal circulation. يعني خلي بالفينس vein or maybe بالarterial vein I do extracorporeal circulation. This is in case when there is a severe adhesion and long time of the tuberculosis maybe lead to the damage of coronary artery, so later need to the CABG, coronary bypass graft. It may be needed. Thank you very much for your listening. I hope that it will be, I know this is a long